Welcome everyone to another edition of our Dow Labs Back to Basic webinar series. Um, Today we're going to talk about sleep and how to treat insomnia. And we're going to talk about this very interesting campaign we did on the website recently where we asked customers to send us a picture of their tongue and answer a few questions. And we did sort of try to guide them to the correct formulas, did a bit of a mock diagnosis. Obviously, that's not the same as seeing a practitioner and getting a full consultation. But nonetheless, it was very interesting. We learned a lot in the process. And so that's a little bit what we want to talk about today. I'm going to give you today, our agenda is to just kind of let you know about our Show Us the Tongue campaign and what we learned from it. To discuss the basics of treating insomnia. I've talked about this in other places, other webinars in the resource room, on the Dow Labs page. We'll look at 3 key formulas: mental tranquility, physical tranquility, and digestive harmony. And I'll give you some tips for how to use these in your own practice, particularly during this moment of COVID-19 where many of us aren't seeing patients in our clinics, but trying to do some things via virtual consultations, by phone, by Zoom, by video chats. And then we're going to tell you what we learned from looking at hundreds, maybe even over 1,000 maybe 1,000 tongues. And we'll tell you how to kind of get in touch with us and what's coming in future webinars. So the first thing to remember when we're treating insomnia is that at its root, we're treating the spirit. This is Shen, as is known in Chinese medicine. And any problem with insomnia is a disturbance of the Shen, which, as we know, resides in the heart. So what are some basic principles for treating insomnia and therefore for treating the heart spirit? I'm going to give you a really interesting quote from Zhang Jingyue. Some of you may be familiar with him. He is a famous Ming Dynasty scholar and doctor, wrote extensively on Chinese medicine, just volumes and volumes, and it's still very influential today. In his writings, he gives us a really useful summary. He says, basically, there's 2 causes of insomnia. So I'm going to read this quote to you that I've translated for you. So he writes, "There is not one single disease that causes insomnia, but there is nothing more to it than understanding the righteous and the heterodox. When the spirit is settled, one sleeps. When the spirit is unsettled, sleep is disrupted. The reason it is unsettled is 1, the disturbance of heterodox qi, and 2, the insufficiency of qi and blood." So and by qi and blood, I think he means something quite extensive. Let's take a little bit deeper look here. So what does this mean? I think it means that basically we can think of insomnia as having, he says 2, but in a sense, we might make it 3 basic causes. There's going to be excess. This is some form of heterodox qi disturbing the heart. Deficiency, some form of deficiency causing the heart spirit to be unsettled. And I think in clinical practice, what we may often see as well is some sort of combined excess and deficiency. The heart spirit is both disturbed by some pathogen, some heterodox qi or evil qi, depending on your translation, and is also unable to settle either because of that or in addition to a deficiency that of qi and blood or other fundamental substances that do not allow the heart spirit to settle. So I've gone into some of these principles in more depth than other webinars, and I definitely encourage you to kind of go back and look at them some more. But let's just talk about what this means, some basics for what this means in terms of using Dow Labs formulas, and how you can do some of this diagnostic, some of the diagnostics yourself virtually. So in our Show Us Your Tongue campaign, Basically, we were asking patients to do a little bit something that you might be doing virtually these days, not quite as extensive, but asking them to fill out sort of short questionnaires and sending a picture of our tongue. What was the most interesting about this to me was that, in contrast to sort of what have tended to see in my clinical practice, we found as many, if not more, cases of what I might call combined excess and deficiency as we did pure deficiency. So I would say in general, when you're talking about a chronic insomnia, something that's been lasting for not a few weeks or a month or two, but really perhaps years, and these are our most distressed patients. Typically, we think of anything that goes on, anything that's very chronic like that as being a sign of deficiency. And in my practice, I've often treated them that way. But in this campaign, we saw lots and lots of cases and lots of tongues that really were more a combined excess and deficiency, if anything, and some maybe just pure excess. So how do we treat these? For treating deficiencies at Dow Labs, we've got two formulas that are really wonderful, and really are sort of your two kind of classic choices. One of them is mental tranquility. We call that Gui Pi Tong. You may be familiar with it, but let's just kind of review quickly what it does, and I'm going to give you a few tips on how to use it. So this formula supplements qi and blood, and if you were to look at the ingredients, which I do in other webinars, you'll see that most of the herbs actually are more qi supplementing than blood supplementing, but often it's classified in sort of the blood, under the blood supplementing rubric in a lot of your textbooks on formulas. And that's because the idea here is that it supplements qi to then produce blood. It specifically targets the spleen and the heart. So, your classic patient here is going to have what we call a dual deficiency of heart and spleen qi, or spleen qi and heart blood. How do we use it? Well, you're going to see some of the classic symptoms of insomnia: disturbed sleep, heart palpitations, forgetfulness. But those aren't totally specific to this formula. But you may also see some things that are more reminiscent of just a spleen qi deficiency. So things like reduced appetite, fatigue, sallow complexion. That helps you a little bit. But there's really kind of a few key things that I find essential when I'm trying to make a diagnosis here. One is that the disturbed sleep tends to be, but not exclusive, but it tends to be more about kind of anxiety and a racing mind. So if you ask people about what it's like to go to sleep at night, or if they may have frequent wake-ups at night, they'll often talk about just being anxious and kind of like unable to stop the thoughts, stop that thought process, stop that racing mind, and they're already thinking about the next day, getting anxious about what they're going to do, how they're going to handle this or that. Those are some classic symptoms. Now, another key point here is this question of heat. Typically, with Gui Pi Tong or mental tranquility, you won't have your patients talking about experiencing heat or sweating at night. But that's not entirely true. Sometimes there will be heat present and perhaps sweating, and even occasionally it can be quite intense. So this can be confusing. We would expect signs of heat to go more with our second formula, physical tranquility, but it's not unheard of for them to see this presentation of heat with Gui Pi Tong, with a Gui Pi Tong kind of pattern. Typically, though, there's going to be a few things to look for. Probably that heat's going to be more exclusive to nighttime, less during the day. It should be a little bit less intense. The patient should be a little bit less agitated than you might see with a physical tranquility kind of presentation. But I think the absolute key is the tongue. And that's what I typically go with here, is if I see a tongue that looks like the image right here in this picture, that's pale and puffy, with a thin white moss, and teeth imprints on the side, then I will typically go for Guipi Tong or dial mental tranquility, and quite often the results are very good. So you may get a little. So I guess the point here is that it's sometimes easy to get thrown off with insomnia. There aren't a whole. The symptoms are typically shared across several different patterns: disturbed sleep, palpitations, vivid dreams, perhaps forgetfulness. Um, uh, Heat or no heat can not always be a great indicator, but the tongue, for the practitioner, practitioner really needs to focus on the tongue. So that's my tips for mental tranquility. Let's turn to physical tranquility. So physical tranquility is our version of Tian Wang Bu Xin Dan. You'll see that I've got a little note at the bottom. We use a lesser known version of Tian Wang Bu Xin Dan, not the one that's typically found in your textbooks, but one that has it is still a classic version, but it's got a smaller percentage of Shengdi Huang, which is untreated Rehmannia. And the reason we like this is because the sort of classic version that you see in your textbooks has a very heavy dose of Shengdi Huang, which is a very cooling herb, and that can be hard in your stomach. And then usually we want to be, we want to proceed with caution. Lots of our patients have all kinds of digestive issues. So this formula, in contrast to Guipi Tong, which focuses on qi and blood and treats the spleen and heart. This formula supplements kidney yin, as well as, I'm sorry, there's a typo there, it should be heart blood. So it focuses on the kidney, the heart, and yin and blood. Now, how do we use this? It's going to have a lot of some similar presentations: restless sleep, heart palpitations. But one difference is you might find that your patients have really sort of excessive or vivid dreaming, perhaps even nightmares, along with these other symptoms. So that's a sign of heat. And you want to look for other signs of a yin deficient heat. Those might be things like sensations of heat in the palms of the hands and the soles of the feet. Constipation could be a possible presentation here because of lack of yin fluids, or sores, sort of canker sores in the mouth, also could be a sign of a deficient heat caused by yin deficiency. So a few of those things might help you. You might not see those for sure, but in general, I'm kind of looking at my tips here. What you want to look for is insomnia, but with a stronger presentation of heat, more agitation and irritability, and that's going to lead to some of the excessive dreaming. You might have more frequent night sweats than you would with mental tranquility. And mental tranquility, you still can see them sometimes, but here you're going to see them more. But the key, I think, is going to be also, again, the tongue. So you want to look for a red tongue with little to no coating, something like in that picture there. But you may also see lots of cracks. You may see kind of geographic coating, some of those classic presentations for a yin deficient tongue. But the tongue, again, is going to be really important here. And you want to check in on a few other things. So here I've mentioned, other signs of heat you might have. If this patient is a woman, she might be in her kind of 40s and 50s, and there might be things like hot flashes as well. Not a guarantee, but those are other things to kind of look for. And then you'll kind of all want to confirm with the tongue. So that's sort of been those have sort of been my two tricks for really distinguishing between when to use these two formulas. There's a significant overlap in the presentation, and so you've got to kind of tune into some of the finer details to really figure out if you're really looking at a sort of a qi deficiency or more of a yin deficiency. Okay, now let's move on to some, and these are all things that you may have been more familiar with, but let's talk about some things that we learned in the campaign, which is that these were by no means the only tongues we saw. We also saw these other patterns of what I would call kind of combined excess and deficiency, and where really your best bet with the Dow Labs products would be something like digestive harmony. Now, digestive harmony, you may all be familiar with this in terms of treating what's known as food accumulation. This formula is Balhovan, the classic formula of Balhovan, preserving harmony pill. So it treats food accumulation, it harmonizes the stomach, it guides movement in the digestive tract. So this is a great formula for all kinds of forms of indigestion. So I would say it's great for indigestion, bloating, pain, reflux, belching, vomiting, but all related to this idea of like a food stoppage, food not distending in the stomach. Now there's, this by no means is the only formula to treat digestive issues, but this is, it is a good starting place, and it also turns out to be one that can be useful for treating insomnia as well. So I'm going to talk about why that'll be in a second, but let me just say a few more words about the stomach and what you want to look for here. So one, I've noticed among many practitioners, there can be a little bit of confusion about when to treat the stomach and when to treat the spleen. But one important principle for the stomach is to make sure that we want the stomach to be open or flowing, if you will. Tong is the word in Chinese medicine. And if the stomach is tong, if the digestive tract is tong, if it's open, this is how you kind of supplement the digestive tract, or supplement the stomach, if you will. So, or supplement maybe more broadly the body, even the spleen. So you don't always need, with a spleen deficiency, you don't always need herbs and a formula that supplements spleen qi deficiency. In part because if there's an excess, digestive harmony treats food accumulation and dampness, these things are excesses, then you need to eliminate that first before the spleen and stomach can start working properly, before they can start producing and engendering qi and blood. And that's how you begin to build up the body. Now, when it comes to treating some of these trickier insomnia cases, one of the things you want to ask for is, does this patient have digestive complaints, some kind of bloating, belching, indigestion, what have you, on a regular basis? And do you see a greasy, thick coating on the tongue? So let me just say a few more words about this. The principles behind this are actually quite straightforward. You find them in the Yellow Emperor's Inner Canon. I've talked about them again more extensively in other webinars. But it's this idea that if the stomach is not harmonious, sleep cannot be peaceful. This is a famous quote from the Yellow Emperor's Inner Canon. And so what this means is that if we're finding patients with gastritis, ulcers, gastric reflux, colitis, a whole range of sort of biomedical GI conditions, what I've found is that it's really essential to treat the digestive issues first in order to resolve the sleep issues. And when you get the digestive things under control, sleep in turn begins to resolve itself. Or it becomes possible to kind of address those things with your other kind of classic strategies that you might find in Hui Pi Tong, mental tranquility, or Tianwen Bu Xin Dan, physical tranquility, and so on. Now, Bao Ho Wan, or digestive harmony, is an amazing formula, and it's useful for so many things. But some of your patients may have very complicated digestive tract issues, and they may require more complicated solutions, things that are really beyond just simply digestive harmony. So that's just something to keep in mind. Now, one possibility is that, as clinics start to reopen and things like that, maybe you're able to kind of combine some acupuncture with digestive harmony and really kind of get to the whole picture. If you're an herbalist who's really into designing your own individualized formulas, then you'll have the whole set of tools at your disposal for that. In a previous webinar, I have talked about a very interesting case among my own patients, where I talked about how I treated a very complicated colitis in order to resolve a patient's insomnia issues, and it worked quite beautifully. So please check that out for more details there. So here's a few images. Now these aren't for privacy reasons. I'm not showing the actual tongues from our Show Your Tongue campaign. but I've collected just some kind of general ones that are available out there on the internet. But I wanted to show you sort of what we saw the least of and the most of. Now, this may or may not relate to your practice, and I can't say for sure if our little campaign was pulling in particular types of patients, and so that may have kind of skewed our results. But I would say the type of pattern, the type of tongue we actually saw the least, we still saw it, but we didn't see it as frequently as I would have expected, would have been this Tianwang Buxing Dan kind of physical tranquility tongue, this presentation of a kidney yin heart blood deficiency. We didn't see a ton of tongues like that. We did see some, but not a ton. Now we did see a significant number of the tongues that fit with Guipi tongue or mental tranquility, these pale, puffy tongues with some minimal coating. But those tongues, again, are consistent with a spleen, heart, dual deficiency, and saw a good number of those. So we saw quite a few of those. But we also saw a lot that kind of are in this third category here, and perhaps maybe even more. I haven't done I haven't actually done a statistical analysis here, but this did surprise us. The number of the tongues like this that we saw did surprise us. And these tongues are sort of more in the realm of digestive harmony, although I want to say they may go beyond sort of what you can do with digestive harmony, but that would certainly be a place to start. One other form you might want to consider would be something like Wendan tongue, which is warm the gallbladder decoction. I think that would be appropriate for this tongue on the left. The tongue on the right might be digestive harmony would be a better choice. So let me break down this last category of tongues, these ones where we're seeing dampness and phlegm in combination with other things a little bit more. So I have just a brief breakdown for us to look at here. And so the tongue now on the top is a tongue that's, this is a tongue that you can see it's pale. It's got quite a thick white coating, a bit greasy. This is going to be a tongue that's going to be most amenable to digestive harmony, which tends to have more warming herbs, phlegm, and some phlegm dissolving herbs, and one heat draining herb for Scythia, but the rest of the herbs are more kind of warming and phlegm dissolving. The tongue on the bottom, now we saw tongues and tongues like that a good bit. You can see that the tongue itself is red, perhaps even a little bit puffy. You can see on the edges, maybe indicating some underlying deficiency there. And then there's a thick coating, slightly yellow, a bit greasy. This is a tongue. This is really a tongue of damp heat, probably with some phlegm. This is going to be perhaps going to be kind of tricky to treat. I think digestive harmony would be certainly a good place to start, but it may not help you resolve all the heat issues. It could get you started on some of the phlegm issues. One tip I want to give to you all here, and this is what I found in my practice, is that when you do see these kind of thick, greasy coatings and indicating kind of dampness and phlegm, whether it's cold or hot, you do want to be careful about using physical tranquility and mental tranquility in these cases. And I would say especially physical tranquility. Physical tranquility has a lot of yin supplementing cooling herbs. Those cooling herbs are they're going to be kind of cloying. They're going to obstruct sort of the qi mechanism. They're going to contribute to even more dampness. And so I've seen patients, I've made this mistake before, and I've seen patients actually kind of get worse, especially if you already have some signs of, like the tongue on the bottom, you already have some signs of heat there, and you think, oh, this is and you might see that tongue is kind of unambiguous there, but you might see some somewhat more ambiguous cases where you can't quite tell if it's, you feel like the underlying tongue is red and maybe a sign of a yin deficiency, but there's a fair amount of, there's still a good amount of tongue coating there, and you're not quite sure what to do. In those cases, you want to be careful. If you see a tongue coating, maybe a little bit more in between here, and it looks greasy to you, you've probably got some phlegm there, And physical tranquility might actually make the insomnia even worse. Of course, if you stop, things will kind of go back to where they were. But likewise, I've had tongues like on the upper left with a pretty thick coating, and I've kind of maybe tried. I've done things like I've used digestive harmony and then switched to mental tranquility, but I felt like sometimes I switched too early, and then that also seemed to kind of make things worse because. And the key principle here is that phlegm obstructs it blocks the orifices, it obstructs the heart orifice, and so therefore disturbs heart spirit, and that's going to potentially lead to worse sleep rather than better sleep. So I think the principle here is, again, look carefully at the tongue, look for these thicker, greasier coatings, whether it's a sign of a cold dampness or damp heat. You want to deal with that dampness and phlegm first. So drain the excess first. Digestive harmony is a start. It may or may not be all that you need, especially if you've got more signs of damp heat. But then once you feel like the phlegm and dampness are resolved, then you want to turn to other formulas if you feel like there's also an underlying deficiency with it too. So that's sort of my one of my tips for these situations. And in our Show Us Your Tongue campaign, we saw a surprising number of tongues like this. Perhaps maybe it's not surprising considering some of the the poor eating habits and the kind of widespread digestive issues that a lot of our American patients have. But anyway, so we wanted to kind of share that little insight with you, and as something that can guide you in your own practice. So that's it for this kind of short little webinar. We want to encourage you to stay in touch. We're really trying to build our Facebook group. It's a great place to exchange practitioner insights and discuss little topics like this. Our post newsletter comes out once every 2 weeks. Watch for that, and we try to have interesting tidbits in that. And we've got more webinars coming up, next week. It's possible that this may get pushed back, but I'm planning on doing another webinar just to talk about Bauhoban or digestive harmony more broadly. Next Friday, we've got a social media panel with some acupuncturists. The following Friday, we're going to talk about telemedicine. And my colleague Jen Ward is going to kind of help you kind of navigate some of the challenges of that and how we can kind of keep our practices going through virtual consultations. And then the following Wednesday, I'll be back here with another webinar on dosage and contraindications. So we're looking forward to seeing you all back here with these at these webinars. Please check out earlier ones in the resource room. We want to be an ally for you during this unusual time of COVID-19 to help you kind of keep your practices afloat and keep you busy and give you resources that are going to aid you in keeping those clinics thriving and busy. So wishing you all the best, and look forward to seeing you. Look forward to seeing you soon again on these forums. Okay, bye all.